from New Jersey is recognized.
Mr. Speaker, I yield 5 minutes now to the gentlewoman from California, Ms. Sara Jacobs.
Gentlelady is recognized.
Well, thank you, Ranking Member Pallone, for your leadership on this issue and for yielding. Vaccinating healthcare workers against COVID-19 is a simple and effective way to save lives. It's helped protect our healthcare workers and the most vulnerable from serious illness, hospitalization, and death. And it's prevented our healthcare workforce shortage from getting worse by keeping workers healthy and able to continue their essential work. HR 497 is nonsense and would expose patients to unnecessary risk, all because Republicans are trying to score political points. That's why my motion to recommit would strike this bill and insert the Women's Health Protection Act, legislation that would actually keep the American people safe and healthy. Since the Supreme Court overturned the constitutional right to abortion access, 24 states have banned abortion or are likely to do so. Without Roe, Americans are now facing a confusing patchwork of state laws, dictating who can make decisions about their health care and when. Without Roe, state governments are forcing pregnancy on people. Maternal and infant health care outcomes are worsening, and it's harder for people to access medications to treat arthritis, cancer, lupus, and more, all because they could also be used for medication abortion. This is deeply personal for me. As a 33-year-old woman, reproductive health care is my health care, as it is for millions of Americans. I want the freedom to make the best choices for my body and my life, and so do other Americans. And that's why Congress needs to pass the Women's Health Protection Act, to guarantee a pregnant person's right to access an abortion and a provider's ability to deliver these services regardless of state laws. Whether we admit it or not, we all know that conversations about reproductive health care in the House chamber aren't reflective of America. Because in real America, whether you're living in a red state or a blue state or a purple state, the average American wants the freedom and the ability to make their own health care decisions, including if, when, and how to have a family. We saw that clearly reflected in the midterms, with Americans mobilizing to defend abortion rights in places as disparate as California, Vermont, Michigan, Montana, and Kentucky. The American people want the Women's Health Protection Act, and the House should pass it again today. That is why, Mr. Chair, I ask for unanimous consent to add the text of this amendment to the record immediately prior to the vote on the motion to recommit.
Without objection.
I yield back.